All right. Just give me 1 second. So we've still got people joining, which is great. We've got a bunch of people that are already here, and I will just continue to admit people in. All right, so welcome everybody. Hi, Fernanda. Hi, Dr. Kanayama. Thank you everybody for joining us today or this evening, depending on where you are. I am in Australia and Dr. K, you're in New York. And Fernanda, where are you again?
Virginia.
You're in Virginia, but you're in the same time zone as Dr. Kanayama.
Yeah. Mm-hmm.
Yeah, wonderful. So I'm just going to do a quick intro. This is already recording. So there were a bunch of people that registered, and if anyone can't make it to hear us live, they can get the recording sent to them. So this is being recorded, just letting everyone know. All right, so I am Kimberly. I am a women's health naturopath and clinical nutritionist, and I specialize in helping women conquer endometriosis holistically using herbal medicine, nutritional medicine, and dietary and lifestyle strategies. I know that Dr. Kanayama, can you still hear me, Dr. K?
Yes, I can hear you.
Okay, perfect. So
Okay.
Dr. Kanayama is from New York Endometriosis. He is a endometriosis excision expert specialist, and Fernanda is his patient who is going to share with us her story today. So I'm just going to hand it over to you, Fernanda, to tell us all about your endo journey and where you're at today. So feel free.
Okay. So my endo journey started back in 2019. I would say that I finally knew what I had. Since the day I started my period, I had really bad cramps. Didn't know what it was until 2019. I got married, and then we're trying to have a baby, and it wasn't working, and we went to doctors, and everybody was kind of like, oh, it's normal, just keep trying, just keep trying. A year and a half later, about a year later, I did my own research, and I was like, well, maybe it could be endometriosis. So I brought it up to my GYN that I had here, and he's like, oh, maybe. So I would have to do do a laparoscopic surgery. So I got that done, and he called my husband and said, it's the worst case I've ever seen. There's absolutely nothing I can do. She would have to have a hysterectomy, or she would have to try IVF, which might not work. So we contacted the IVF doctor, which it just happened that, they both worked together. And he said, yes, I received your medical records from, your GYN. And we could try the first time, but it's not guaranteed it's going to work. And it will be this much for the first time. But if it doesn't work, we try again the next time, and it'll be a little bit less. And again, not guaranteed. So we could try one more time. And then if it doesn't work, I'll charge you a little bit less. So then, it was like, I don't think so. And then we went back to the GYN, and he's like, yeah, no, you can do that, or we can have a hysterectomy, which is what he recommended, knowing that we wanted to, start a family. Me and my husband start a family together. Or he's like, I don't know, but you cannot find anybody that is going to take care of what you have. Lucky enough, I started doing my own research. I came across Dr. Kanayama's profile, and then just happened to be someone that we knew, that actually my husband's mom's best friend had her daughter had surgery with Dr. Kanayama that same year. So we talked to her about him, and she gave us her testimony. And then I called him, I think, the next day. And we set up a Zoom. He was just like, I don't know. He heard me. You know, it was everything I showed him, everything I talked to him about it. He's like, yes, this is what you have. Yes, 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 I can take care of it. We made an appointment, and then we had the excision, which I believe that the previous doctor that I had my surgery with before, he actually did ablation, and obviously it didn't work. I believe Dr. Kanayama mentioned that that helps spread, and so I had it even more places that probably I had before. He never mentioned how my ovaries and uterus was, which Dr. Kanayama was able to do it, you know, the same exact day of my consultation with him. So I went in for surgery, and then 2 months later, I was able to get pregnant naturally, not even trying, because we were trying for a year and a half. So Dr. Kanayama even said, wait one more cycle. So it's like, okay, well, we've been trying, you know, trying. We know that this is the day we have to do it, so let's not care anymore. So it wasn't even like planned for it to happen. And then I called Dr. Kanayama like 4 weeks later. I was like, I don't know what happened. And I was
Yay,
pregnant.
amazing.
Yeah. And then I was able to do it again last year. Again, naturally, it just happened. So very, very thankful for what he did. And it's, you know, it's proof that you do not need a hysterectomy. And you know, it wouldn't have worked anyway, because I had endometriosis more than my ovaries and uterus. So it wouldn't have
Yes.
worked,
And
even if I
so
had a
where was your endo found?
correct me if I'm wrong, Dr. Kanayama, but I believe it was rectum, it was uterus, it was ovaries, it was lower intestines, I believe, utera.
So it was
Any other
pretty
place?
advanced, wasn't it?
It was back when I saw Dr. Kanayama back in 2020, Dr. Kanayama words was, you are also one of the worst cases I've ever seen.
Wow. And do you want to share a little bit about that, Dr. K, and just elaborate on why it was one of the worst cases?
Yes. Where can I start? So she has stage 4 endometriosis. It's called DIE, deeply infiltrating endometriosis. And I do have her pathology report right here with me. I don't know if you guys can see this. Maybe it's not easy to
No,
see.
it'll be a bit blurry, I think.
Yeah, it's gonna be, yeah. So it's not gonna show up anywhere. But all of endometriosis I excised from her, showing endometriosis with calcification. And
Wow.
so this literally means her endometriosis is not soft at all. It's like a cement hard, like a concrete. So
Wow. So it
when
had calcified.
calcify, yes. So when I cut in by my scissors become like almost like a dough. Because the endo is so hard, I'm feeling like I'm cutting a stone by my
Wow.
scissors. And
Wow.
everything is so stuck together. So she had a frozen pelvis, completely obliterated pouch of Douglas, bilateral ovary completely stuck to the pelvic sidewall, and ureter is constricted, and there's a deep nodular endometriosis invading bilateral periuterine artery area, and her perirectal endometriosis is way over 3 centimeter deep. Some areas like a 4 centimeter, and also constricting the rectosigmoid colon, and her endo is invading into the posterior vaginal wall. And
Wow.
it's augmented together like this.
Wow.
So I will say it's not easy at all. And I think I spent about 6 hours to taking care of her case. And probably I am doing more really difficult surgery recently, but I would say Fernanda's case is one of the maybe top 20 difficult case I have done in my life.
And you've done a lot of
Yeah.
endo excisions.
Yes, I do. But it is really humble me, like how aggressive endometriosis can become, and how much patient can suffer from this disease. So, so I literally, during the Fernanda surgery, I literally feel her pain. Oh my gosh, this is so painful. Oh my gosh, how deeply hitting and cementing everything together. So I really concentrated hitting every endometriosis. That's why in my Instagram, I'm kind of emphasizing haptic technique, and that is so important. You have to feel every tissue, and because of her cemented endometriosis, it's everything underground. So you
So it
can
could have
only
been easily missed unless you knew what you were
it is
feeling
very easily
for.
missed. Yes. So I would say 80 to 90% of rectovaginal septum endometriosis is completely invisible.
Wow.
It's hidden. So only way I can detect is I need to touch every layer of the tissue, layer by layer, and I need to feel the test the water, feel the water.
Yeah, because the
And
diseased tissue, especially if it's calcified, like you said, is like cement. It's hardened itself.
right, exactly, yes. So thank God, I didn't give up, and I finished to the end, and I clean up everything. I find the roots.
Wow.
Then I was so shocked. She became naturally pregnant in 2 months. So that is
Wow.
really yes.
So it just blows my mind that you were Fernanda was advised to proceed with IVF
Mhm.
after she was told that she had such severe stage 4 endo
Mhm.
frozen pelvis and her fully obliterated pouch of Douglas, as you were saying, Dr. K, and so much more. So how did that make you feel, Fernanda?
Well, see, for me, it was reassuring because I went for a year, I went through, blood work and tests and ultrasounds and all this, and nobody ever mentioned anything. Like when I went to Dr. K so it was a Monday and then my surgery was on a Friday. That Monday, he told me that, one of my ovaries were on top of my uterus, the other one was behind. And then for me, it was like, how did they not see this? I had many, 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 ultrasounds done. And the blood work, when it came back, the numbers for, I'm sorry, it went blank, the blood work that he does, the name of it.
Mhm.
It's CA125.
Right. The numbers were, high, and I had plenty of blood work done before. How did they not? So it was 3 different people. How did they not? They sent me to a specialist, to look at, or MRI, whatever. How do you not see it? How did you miss it for a year and a half? That was my whole entire thing. And the only thing that I was told, so before we got married, um, I was told that because I was in pain, and again, I always mentioning that to him. He said I had fibroids.
Mm.
Like that's all you have. You have fibroids, so that's why you can't get pregnant. So then that way it was like, really, fibroids, I can get pregnant. So then I'm freaking out, but it was not fibroids. So when I actually had, because it was COVID, so my first consultation with Dr. Kanayama was over Zoom. And then I just stood up and he's like, you have endobelly. And then I told him about my headache and I told him about the pain down my leg. And then, like falling to the floor in the middle of just the day from pain. He's just like, yes, 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 yes. I just felt so relieved. So
Yeah,
relieved.
and I think there's so much therapeutic benefit in finally being heard and finally being validated when it comes to our endo journey and the range of debilitating symptoms that we experience for so long
Yeah.
because they
Once I
so
got
often go amiss.
Yes. And then once I got my medical records from this doctor, the previous doctor, I was just looking at it. It was 5 years of like, I had the pain before, but I was, not the birth control to help, but I was on it. So it might have a little bit. But
Mm.
for 5 years, you can see there, me calling every month, complaining of heavy period or pain and all. It's just there. He had it. He knew something was going on. That was not normal. That every month I had to call and, I need to be seen because this is not right. I need to be seen because this is too much. I need to be seen because, you know, my clogs, I had blood clot, like
Yeah.
insane. You know, it was not right. And for 5 years, nothing was done about it.
Wow.
Not
that's
counting, you know,
massive.
the before time that wasn't as bad as, you know, it started from 6
Did you
years
have
before.
adenomyosis as well?
Yes, I did. It wasn't as bad, thank goodness, as, you know, some cases I've seen him do, but I did.
Okay. Okay.
Yes, adenomyosis is located backside of the uterus. Then, if this is uterus, rectosigmoid colon is right here, and her adeno is fusing rectosigmoid colon to the backside of the uterus like this.
Wow. So did
So
you
like
have
one structure like this.
so
So
you
I need to slice.
yeah.
Yeah, so I need to slice in the middle of adeno. Then I'm able to establish the space in pararectal space bilaterally. Then I was finally able to, after 3 to 4, 5 layers of cutting, I was able to establish the beginning of rectovaginal septum. That is a space between rectosigmoid colon and the posterior vaginal wall. And that's where her most hardest cemented endometriosis is located.
Wow.
And so that's coming from her adenomyosis.
Wow. So the
Right,
adeno was fusing her rectosigmoid colon to her uterus, and that was
right.
very calcified.
Yes. And
Yeah.
so by how I can find adenomyosis is because again, I can feel adeno texture. So you can feel the texture of adeno, I slice, texture of adeno, I slice. Then I know the difference between normal uterus feel like and how hard adeno feel like. There's different texture. Then once I get to the normal uterus, then I stop my cutting. Then that's where her uterus remains instead of hysterectomy.
Wow. So by identifying where all the diseased tissue was, you were able to then, can you just explain your technique, Dr. K, and how you removed this?
Yes, basically, my technique is actually pretty simple, but it's hard to do. It's like, yes, I am holding my own scissor, my scissor
Yeah.
by my hand, yes, and also by the laparoscopy. So I think many people ask me question, difference between me and, for example, Da Vinci robot is in the robot machine is holding the scissors. So machine is kind of holding, and the machine is try to cut the adeno, but the machine cannot feel anything. So doctor need to, really only looking at adeno, then, kind of guessing how adeno feel like. But in my case, I'm really feeling adenomyosis. So I was able to differentiate because my hands knows difference between normal and adeno and normal and endometriosis. So I was able to slice all of this disease up to down to the deepest root. And not only deep root, I'm able to see the endo band, adenomyosis causing a fibrotic band, and all of the pooling, tugging band need to be excised for the Fernanda to get better. So
Yeah.
this is a whole process. Yes, it's
It
complicated. Yes.
it sounds extremely complicated, and I'm so thrilled for you, Fernanda, that you got your miracles, your miracle babies. Like, oh wow, what an incredible and inspiring story of hope. And I'm so grateful that you're able to share
And,
this with us
and
because
it was so much fun. Fernanda post-op visit, she brought her babies, and so it is such a joyful moment for me. So I was able to hold her baby. So I'm able to bless
wow,
her by my
yes,
hand. God
so
bless her.
amazing. So question for you both, actually. I'm just rewinding back to when you said, Fernanda, that your initial surgeon did a laparoscopy, but he diagnosed you, but he didn't touch any of the endo. So Dr. K, in your opinion, and I know where I stand on this, is that no surgery is better than poorly done surgery or ablation surgeries. What do you think about the fact that she didn't have anyone in there trying to remove it before you went in?
So,
I
oh, go ahead,
sorry.
please.
He actually said that he did what he could. And when I went to Dr. K was like, no, he did absolutely nothing. That was, I was told something different than what it was actually done, just to clear that.
Oh, okay. So he didn't actually try to excise anything, but he said he did what
Yeah, he's like, this is the worst thing I've ever seen. There's nothing else I can do. I did what I could, which
Okay.
was not.
Okay.
Yes, so when I enter into the Fernanda's inside, I can tell superficially, like rectovaginal septum area, something is touched, something is burned. So I can see some kind of like a burning sign on the tissue. But once I go inside, nothing is touched.
So superficial ablation, do you think was performed?
I just don't know exactly. I don't really see his surgery, so I cannot really tell. But as 90% of the deep endo is not even touched because
Wow.
it is not open up inside.
And you said the
So
only way you really detected that was by being able to feel that tissue because it was all underneath.
you need to feel the tissue. Yes. Otherwise, if you cut the wrong place, it can easily cause complications. It is very dangerous.
Yeah. Wow. Wow.
So to answer to your question, I do believe no surgery is better than bad surgery.
Yeah. Yeah.
It's much
Absolutely.
better to do one correct surgery instead of multiple burning type. So I don't encourage any endo sister to do burning surgery.
Yeah.
Right.
Yeah. And that leads me on to my next question about IVF, because Fernanda, you were encouraged to go to IVF. And personally in clinic, I have seen exacerbations of endo symptoms with patients who undergo IVF before they get excision. What do you think about that, Dr. K?
From my own experience, I have seen so many miracles happening, including Fernanda's. So I really believe endometriosis need to be excised completely to the root of the disease. And also endometriosis need to excise to the pinpointed size. Even one tiny dot need to be excised. The reason why the endometriosis is causing such a toxic environment for the endo patient to conceive and to carry the baby. So from my own experience, once endometriosis is completely excised, so many patients naturally become pregnant. And the Fernanda is, one of my example. And so I do recommend clean up endo. I do recommend your body need to be changed. Your pelvis need to be changed. Your body need to become, instead of baby hostile pelvis, to baby friendly.
Yes, yes. And I think
Yes.
that's incredible that you've just said that, because that's kind of looking at the patient as a whole person rather than just looking at their disease. And that's a very naturopathic way of looking at them, because endometriosis can affect you systemically. As we know, it's not
Yes.
just pelvic disease. It will create systemic inflammation, for example, and affect you in other organs. So yeah.
And it will make you tired, fatigue, sleepy, heaviness, migraine headaches, skin breakdown.
Yeah, all
And
the things.
it's really, your whole life is affected by this disease,
Yes,
not only unable to carry the baby. So you need to become healthy. And I do believe healthy body can carry the healthy baby. And it will open up the whole door to naturally become pregnant
I
instead of
love
IVF.
that. I love that. I just have a question for you, Fernanda, from one of our participants, Linda here. Do you mind sharing how old you were when you got the surgery?
I believe I was 32.
She was 32. Okay.
Yeah.
We have someone asking is DIE the same as adenomyosis? No, but adenomyosis is specifically to do with endometriosis-like tissue that grows in the uterine muscle itself. So it is different, although it is deep as well. So yeah, I have a question here, which asks, it's from Jill, who says, how long can someone go without surgery? I was unofficially diagnosed with endo and adeno after years of fertility issues and 2 miscarriages. I was sent to an oncologist who said, based on her numerous ultrasounds and an HSG, that I had too much scar tissue and there was no reason to go in and disrupt everything when it didn't look like the endo was spreading. He was told me it would be a bloodbath if he went in. My fear is it spreading to my other organs. Do you have something to say about this, Dr. K?
Okay, I'm sorry, I missed that.
That's
Main
okay.
part
She
of the
was
question, yes.
unofficially diagnosed with endo and adeno after years of fertility issues and miscarriages.
So unofficially diagnosis means no laparoscopy, but just by imaging only.
I'm assuming so, because based on her ultrasounds, her doctor
Right.
said there was no reason to go in and disrupt everything when it didn't look like endo was spreading, but she's having fertility issues. She's concerned that surgery could potentially, oh no, she said, my fear is it's spreading to her other organs. But the doctor said he told me it would be a bloodbath if he went in.
I disagree, and because of she need to have a correct diagnosis, especially she's not able to get pregnant and she's having many other symptoms. And the only way to correctly diagnose endometriosis is laparoscopy.
Yeah. And we know,
Yes.
I mean, even Fernanda shared that her ultrasounds were clear. I mean, I had clear no one said anything about my ultrasounds. There was endo everywhere. You know, we know that imaging is not accurate.
Right.
Yes. Now, another question from we have a participant named Jody from Canada. Our 15-year-old daughter ends up in the ER every month on IVs for horrific pain. We have changed diet, do supplements, acupuncture. Nothing is helping. She's been offered a hysterectomy, oh my gosh, which I know is not the answer. And she wants children one day. If she has surgery soon, would she need surgery again when she is older and wanting to try to have children? This has been a horrible year. Oh my goodness. Firstly, I'm just horrified that doctors are recommending 15-year-olds to get hysterectomies. It's like, this is mind-blowing to me. But feel free to add what you think. She's asking if she has surgery soon, would she need surgery again when she's older and wanting to try and have children?
Of course, there's no brainer, but no hysterectomy for her.
Oh.
And but she does need a diagnosis, and she needs to know if she has so much symptom and so much pain. Of course, I need to examine her first and to understand what is really going on. But if she has really suffering from endometriosis, then hysterectomy is not the answer. Any age, not only 15 years old, but 25, 35, even 45. Because of endometriosis is located outside of uterus.
That's right.
And also, I'm sure most of the endo sister already knows, but endometriosis tissue is separate from endometrial tissue. So endometriosis can produce its own estrogen. And endometriosis is also resistant to progesterone. And so it is not really same tissue. And endometriosis behave like almost like its own cancer cell. Like they have their own factory inside. So endometriosis need to be addressed and taken care by site, not by removing uterus, not by removing ovary, not by making menopause, by Lupron or Elisa. And this method doesn't work. So if she's suffering so much, I do recommend laparoscopy and exact diagnosis of endometriosis and minimum no burning cold cut excision of endometriosis.
Yeah, and I'd just love to add something there because so many of us have been symptomatic from a very young age. And leaving that diagnosis too long, I believe can further complicate things later in life. So I would recommend, if you can, get proper excision surgery. And then you mentioned that you are already working with a naturopathic doctor for diet and lifestyle and everything else to prevent recurrence. I think that giving her that clean slate would just improve her quality so much. I know that as a 15-year-old myself, I missed out on so much socially, you know, in terms of my schooling life, social life. So many things was impacted by the fact that no one knew what we were dealing with. Given that you have this knowledge, you can now proceed with the right path and the right decisions to ensure that your daughter gets the proper excision surgery that would benefit her. That's my personal opinion, because I have such a heart for young girls who are dealing with this, because that was me one day, many years ago. I have a question, Dr. K. What about retroversion, a retroverted uterus? Is it even more complicated to deal with stage 4?
Retroverted uterus can happen often in stage 4 case. So one of the reasons why retroverted uterus can happen is endometriosis develop like a backside of the uterus, and this backside of the uterus endo region is actually pulling the uterus to the backside. And that's kind of like a similar to Fernanda's case. This adenomyosis, which is causing a retroverted uterus, and the anterior side of rectoshumeral colon, they fuse together, and they're going to move the uterus back to the lower back area. So that's actually common presentation with stage 4 DIE type of endometriosis.
Yeah.
So I'm not surprised. Yeah, retroverted uterus. Like I'm seeing many patients with retroverted.
Wow. Okay. What do you think if you're no longer trying to conceive and just trying to manage pain through diet and lifestyle? Is it still important to have endo and adeno excise to help prevent other diseases like cancer?
Endo adeno to become cancer is very small. So it's less than 1%. Although endometriosis can cause ovarian cancer, endometrioid cancer, I'm seeing a couple of patients, endometriosis develop ovarian cancer. But out of almost like I have done 6,000 to 7,000 cases, I'm only seeing 1 or 2 cancer patients. So it is very small endometriosis developing into ovarian cancer. Is that your question? I don't understand.
She's saying, is it important to have it excised to help prevent other diseases? I think it's more about improving your overall quality of life if you're no longer, fertility goals.
Yes. So excising of endometriosis, also adenomyosis, so important. Not only increasing the chance of getting pregnant, but if you're not interested in pregnant, endometriosis significantly change your lifestyle, like a day-to-day lifestyle. You don't have any normal life, and you get tired. All kinds of generalized symptoms you are having from toxic effect of endometriosis. So no medication, no birth control pill, or this Lupron, all of these manipulation not going to remove toxin from your body.
That's it.
And so, right. So you need to become healthy from toxic effect of endometriosis, and your body going to be detoxified by the complete excision of endometriosis. So you can regain your life.
That's really important as well. Again, because of the effects of the endo is so systemic, it's not localized to just where the growths are. Do you take the appendix out when you do your surgeries, Dr. K? Someone said that her doctor always takes out the appendix just because it's a common place for endo to grow.
No.
Not unless it's diseased.
Right.
And even then, would you remove it, or would you remove the disease only?
If appendix is infiltrated deep inside, then whole appendix need to be removed. And the other patient having a superficial endometriosis on the appendix just recently, I just removed the endometriosis.
Okay, that's good to know. And that's actually funny that Cassidy, her name is Cassidy, asked that question, that she said that because I actually had emergency appendix surgery at 14 or 15 years old, but thinking back now in hindsight, I believe it was an endo flare. I don't think I had an appendicitis. So my appendix was removed, but I think it was, knowing what endo is like, I believe it was endometriosis the whole time. Yeah, that was quite traumatic as a young girl. There's an interesting question here. I personally have never witnessed this. I'm wondering about any stories of naturally reversing and healing stage 4 and avoiding excision surgery entirely through a mix of anti-inflammatory diet, herbs, enzyme therapy, castor oil, massage pack, stress reduction, etc. Stage 4. I personally have not.
I don't know anybody.
Yeah, stage 4 is I think you need some physical intervention in there. Even, but then again, it's hard to prove as well. I mean, again, how do you prove without before and after looking at the disease, right? Visually seeing what's happened. So personally, no, I have not. Can it be common that the first few cycles might be irregular length in following excision surgery if you're still healing? That's a great question. I know that for the first few periods, they can be quite erratic after surgery. Fernanda, what was your experience like post-op with your periods?
I have to say, like, when I have, a lot of those questions, because, we have a group and then the girls always ask, how was your recovery? Everybody knows that everybody's different. For me, I believe I was on my period when he did the surgery. So then my next period for me was a surprise. I had no pain, nothing. It was lengthy. It was, I think I bled for like 8 days, 9 days. I did talk to him about it. He said it's normal. It's just my body getting rid of all the toxins and everything that he had just worked on. But I have to say, to this day, I have no idea that I'm getting my period if I don't track it.
That's awesome.
Unless I track it, I have, maybe my husband can say PMS, but I don't know. Like, as far as pain or, any of the symptoms I had before, thank God and Dr. Kate, I have no symptoms at all. From the first day of surgery until now, 4 years later, I have no symptom.
That's amazing. That's I mean, I'm so grateful that I kind of operate in that space now where I am in an era of periods catching me off guard. And I feel like that's one of the best things ever. It's like, oh my gosh, you're here. I didn't even realize you were coming. Because the premenstrual tension and pain was always so incredibly debilitating as well. Sometimes the pain before the onset of the period was worse, and then you get some sort of relief once the flow starts. But yeah, no, I'm so happy for you. We've got a question from Rachel. She's asking, is there an established cause of endometriosis, Dr. Kate? And I know we don't really know. We know aggravating factors, but we don't know the exact cause. Feel free to.
We don't. Yes, we don't know at all. So unfortunately, endometriosis is so complicated disease, multifactorial and multidimensional. So, of course, there's some genetic component, some environmental, and but if we know the cause of endometriosis, we can win the Nobel Prize. Nobody really know what is really causing endometriosis.
There are so many things that we know aggravates endo and feeds into the disease process. And that's when we go, these are the things that we can work on. These are the things that we know we can control. We know the things that drive inflammation. We know the things that throw our hormones out of whack. And those are the things that we can be proactive about. Question back to the young girl, the 15-year-old girl I mentioned earlier. If she had surgery with you, would she need another surgery in a few years when she wants to have children?
Not necessary. And my recurrence rate, one of the most updated recurrence rate for for example, stage 3 endometriosis is close to almost like a 5%. That's 5% recurrence rate after 5 years. So, which means 95% of my patient doesn't require another surgery for 5 years. So majority of my patient, can go on like Fernanda's.
Which is amazing. And this is when I would definitely say this is when you want to make sure that post-op she really gets guided in the right directions to do all the right things to prevent aggravation and recurrence. And that's where I think you mentioned earlier that you're seeing a naturopathic physician. This is when all of that stuff that's being implemented can be very helpful for her post-op. We had the appendix question. Okay, question. I understand that endometriosis can lead to some autoimmune disease in the future. What is the risk for other autoimmune diseases after someone has endometriosis excision? I personally haven't seen any data linking increased risk of autoimmune disease post-excision at all. I don't personally know.
Yeah, I don't either.
Yeah,
No.
and I think we need to clarify that endometriosis is not technically an autoimmune disease. There's immune dysfunction. There's definitely immune dysregulation and immune dysfunction in the pathophysiology and how endometriosis grows and spread. I mean, your immune system, which is meant to be mopping up cells, isn't doing that when endo cells are spread out. It's growing because your immune system isn't, what we call immunosurveillance, isn't doing its job properly. So there is immune dysfunction, but endo is not considered an autoimmune disease. However, we know that because of the immune dysfunction, there are many women with endometriosis who have concomitant autoimmune diseases too. So that's not uncommon. But with regards to the risk of developing other autoimmune disease post-excision, unfortunately, I don't know, and I've never really seen any data about that. Catherine is talking about how endo and adeno increases inflammation in the body. There are statistics that show inflammation is a precursor to other diseases. Yes, we know that inflammation is an underlying root cause of so many chronic diseases. When endo and adeno is excised, coupled with diet, your inflammation biomarkers can significantly decrease. Yes, and that's because endo in itself is a little factory of creating its own inflammation. And Dr. K said earlier, I've created some interesting posts about this in really easy to understand visualized ways that describe this process actually, and that the CA125 run before and after her surgeries, and the results are nothing short of amazing and is now below normal. Exactly. And even though CA125 is technically a cancer marker, I mean, CA125 can definitely be elevated with endo, and you'll find that once your endo is removed and inflammation is suppressed and downregulated, that CA125 can definitely normalize. I see that a lot too. That's really, really important for women to know. Okay, Courtney is sharing someone naturally reversed endo and got pregnant 2 times through diet and lifestyle. She's talking about this book called Heal Endo. That's amazing. That's amazing. If you have surgery with Dr. K, what is the likelihood you will need another surgery? Oh, okay. We've said that your recurrence rate was, did you say stage 3 endo 5%?
Yeah, 5 to 6, yes.
Yeah. Okay, someone wants to know, okay, what are some of the things that aggravate endometriosis? Okay, so when we look at the inflammatory nature of endometriosis, anything that drives inflammation will have the potential to aggravate your symptoms. So from a naturopathic perspective, we look at the root causes that can drive this. So any dietary factors that drive inflammation, we now know that there is a link between the bugs, the microbes that live in your digestive tract, and the potential for that to drive up inflammation, immune activation, and then aggravate your symptoms as well. There is actually an interesting paper that I read, which shows that the peritoneal cavity, so that's within your abdominal space, and the fluid in there in women with endometriosis was actually so much more inflamed and was correlated to the microbes in their gut. So there is some sort of inflammation in the gut. It's leaking out the intestinal lining, and then driving inflammation within the peritoneum. And this is literally what is making physical contact with your endo lesions. So from a naturopathic perspective, we really place a huge emphasis on downregulating that inflammation. We also know, as Dr. K mentioned earlier, that endo can make its own hormones. So we want to make sure that your hormonal metabolism and how you excrete and clear your hormones through your liver and your bowels are optimal. And we can look at hormone testing and things like that. So immune dysfunction, inflammation, gut imbalances, and hormonal imbalances are all key things that can aggravate your endometriosis symptoms. So these are all root causes of your symptoms. We never say we can, heal or cure your endometriosis, but we can definitely tackle your symptoms at their root causes. So that's to answer your question. I have a question for Dr. K. How often do you see endo in other organs such as the lung and the diaphragm? Do you search for this and remove if you find it in your surgery? So thoracic endometriosis.
Yes, I always look for the diaphragmatic endometriosis. And also, if patient having already having a MRI, CT scan, all of imaging studies showing any evidence of involvement of across the diaphragm endometriosis, then I will involve thoracic surgeon to combine the surgery together. And
Right.
so it can happen, but in my patient base, probably most of my patients come to see me is mainly having endometriosis in the pelvic cavity and the small intestine, and also up to the diaphragm area. And these are the ones I remove.
So you remove it off the diaphragm yourself?
Yes, I do. Yeah.
Okay.
But if you need to go to much higher level, then we need to combine with surgery with thoracic surgeon.
Okay, that's good. I've actually got one of my patients from Singapore on here. She's just asked a
Okay.
question. Oh, hi. Can endo or adeno cause ovulation pain? Absolutely. I have been having endometriosis since my early 20s, but only in the past 1.5 to 2 years, I have ovulation pain. Even last time when I had cysts in my ovaries, I didn't feel any ovulation pain. I would definitely say yes, it can.
Yes.
Yeah.
Yeah.
And how do you describe endo? How do you describe how endo can cause anxiety and depression? My doctor said it's because of all you're dealing with, change in body pain, doctor's visits, etc. When my gut is telling me my extreme anxiety is a direct cause of the actual disease. Okay, so we know that systemic inflammation can also cause like literally brain inflammation and change the way that you process your brain neurotransmitters. So this is me getting
Yeah.
quite nitty-gritty into the little pathways. Earlier on, I spoke about the link between your increased intestinal permeability and toxins being able to leak through your intestinal tract. And when you have a leaky gut, you can also have a leaky blood-brain barrier. So the toxins can also go into and affect your brain. So that can affect your mood. The other ways is through hormonal dysfunction. So if your endo and adeno has hormonal dysfunction as a root cause, this can play a role in your neurotransmitter production as well. So the way you process, metabolize, and make your brain chemicals, and also nutritional deficiencies. Somebody who has endo and adeno might be deficient in certain nutrients. For example, a big one is omega-3, and if you are deficient in your good fats, you're going to be more prone to inflammation. And we know that omega-3 is extremely beneficial for your central nervous system and brain function too. And also things like iron, zinc, magnesium all play a role in your overall mood balance, etc. Okay, great. Someone's just had second laparoscopy, 22 years old. Oh, this is my patient here in Australia. And completely left completely excised. Woohoo. The next conversation with my doctor is involving fertility. I've already been told I need to have kids before 30 due to severe endo. However, being told my AMH has dropped nearly half in 1 year, I'm worried about getting pregnant. How long I have to try? What is your opinion? So what do you think about 22 years old, having kids before 30?
My opinion,
Yeah.
it's once endo is completely excised, it's very likely she can become pregnant naturally, even without any medications. Like I have one patient I was talking to Kimberly before. This is like a very extreme case, but she tried 2 or 3 IVF cycle before come to see me, and she already become like age of 46. So I'm not really, but if she can become pregnant, it's great. But she has a symptom of endometriosis, pelvic pain, and all of her body is so tired, fatigued, sleepy, almost like a feeling a heaviness and having a headache. So I help her, I treated her, and I find the stage 3 endo, and I completely removed the endometriosis. Then, boom, like almost like 1 month to 6 weeks after the excision, she's naturally become pregnant at the age of 46, and she
Wow.
delivered a baby at 57. So,
Wow.
so this kind of stuff can happen, and so it's really once endo is completely gone. I think one of my surgical approaches, I don't want to even miss pinpointed size of endometriosis. One tiny point, it doesn't matter. So when I do endo surgery, I go after every tiny endometriosis and make sure to remove from your body. And I go after to the deepest root of the endo. And that will really cause you anti-inflammatory pelvis and also help you to become pregnant naturally.
Yeah. Yes, because
That's my
endometriosis
stance.
is hostile. It's such a hostile environment for conception to take place. So, and I just want to say as well, your age is on your side. She's only 22.
Yes.
Beyond the AMH, like people get so caught up with the AMH, but we need to remember that age and egg quality is the number 1 thing, because you only need 1 healthy egg for 1 healthy baby rather than a really high AMH number. So I would be more I would be more concerned about, that egg quality and knowing that you have age on your side. I have a great question here. Is birth control necessary in treating stage 4 endometriosis? Personally, I would say definitely not. But feel free. Fernanda, were you taking birth control?
I was, and for the pain, whenever those 5 years that I said I was with the previous doctor, he kept changing my birth control because he thought that that's what it was going to help me. And obviously, it didn't. So when other people ask me that question and does birth control treat endometriosis? I would say absolutely not. It does not. It does. It might mask your pain, but it does not treat endometriosis. No, I think I've taken in 5 years like 8, 9 different types of birth control, and none of them worked. So
I completely agree with Fernanda's statement because of birth control pill is only symptomatic treatment of endometriosis. So just like a pain medicine, when you have a pain, you take pain medicine, you forget about pain temporarily. So, but the cause of your pain is still inside your body. So even though you take birth control pill not gonna shrink your endometriosis. Birth control pill not gonna make your endometriosis region away. It's just hormonally manipulate your entire system. So I agree. It is not really, it's just for the symptomatic treatment of endometriosis, but not disease of endometriosis. So I don't necessarily recommend my endo patient, my post-op endo patient, I don't automatically put them into the birth control pill.
And I think that's really important for women to understand. Understand that you need to make a very informed, well-informed decision if you decide to go on the pill. The pill does not go without side effects and adverse reactions. It also completely shuts down your menstrual cycle. A lot of women that I speak to think that they are still getting periods whilst on the pill. And I break it to you, ladies, that even if you go that week with the sugar pills or you don't take anything for that week, your bleed is not a period. You only experience periods when your menstrual cycle is not suppressed after ovulation. That's a true period. So there are also benefits to undergoing your natural menstrual cycle and ovulating and getting real progesterone in your body. Okay, so it's never necessary to jump on birth control for endometriosis. Is it symptomatic treatment? Yes. Can it sometimes be beneficial? Yes, but don't let anyone tell you that it's ever necessary to get on birth control for endometriosis. And this is, you know, coming from me as well, who I was on the birth control pill for years and years and years. So yes, it is a controversial topic though, because it does ruffle some feathers when you're quite adamant about your stance on it. And I'm not saying that there's anything wrong if you need to take it for symptom management. You should just be looking for the root cause and still don't let that go unaddressed. So yeah. Was there anything else you wanted to add, Dr. K or Fernanda? We do have a bunch of questions, but we are running out of time, and we're recording this so that we can put this up on our social, so we need to cut it now in a couple more minutes. So was there anything else that you wanted to add, Fernanda, or share about your journey, your story, your experience before we say goodbye?
I just wanted to say that, you know, if, you know, whoever's here and is going through it, or if you're someone that already had your surgery and it worked and it was a haptic surgery, you know, no robot, no ablation, please just share your story. You know, if you have any questions for me personally, you can send me a private message on Instagram or whatever. My name is on here. You can find me and I'll answer any questions. I see questions from you right there, but just I feel like we as women should share and not be afraid to tell other people, hey, I'm in pain, or hey, you know, this is what's going on. This is my experience. What was your experience? Just share, because once you do, you're going to find other people that were in the same boat as you. And then you could share your story and you could help that person, and that person can help somebody else, or that, you know, it just, the chain goes on, and it's an amazing thing to have that group of support, that you might not know that your neighbor have the same thing, that, you know, is going through the same thing that you did, and now you're able to help them. So that's what I say. Just share, ask questions. Don't be afraid. Don't be afraid to, you know, put yourself out there to other women, because I feel like we should just build each other up. And that's how.
Absolutely. Yeah. And thank you for sharing. Thank you for being open to do this and sharing your story with everyone. I think everyone would agree that, yeah, it's very inspirational and definitely plants a seed of hope in people who might feel discouraged along their endo journey right now. So if anyone wants to get in touch with you, they can reach out to you, on socials? Yep, on Instagram. And Dr. K, how can people make contact with you and your office through Instagram?
Yes, you can contact me Instagram. Alternatively, you can just call my office, and somebody's there to pick up the telephone and answer your questions. And if you'd like to come to see me, they will give you an appointment. And,
yes, because there are some questions about, you know, waitlist times and things like that. So if you just want to contact Dr. K's rooms directly, that would be amazing. And if anybody wants to, you know, just have a chat and share your story, or want to just vent, feel free to reach out to me in my DMs.
Just one more comment.
Yes.
Just like Kimberly said, hope is available. So my message to endo sisters, endo community, please don't give up hope. And let's keep fighting until you find the answer. Don't compromise your life. Your life is so important. You can regain your life. You can become pregnant if you want to become pregnant. You have a choice, of course. But you deserve much better life. So you are no longer a victim. You can become victorious out of this process. And I witnessed so many of my patients can become victorious. I saw before my eyes. So please don't give up. Let's find an answer, correct diagnosis, and correct treatment, so you can start a new life.
Love that. That means a lot because so many of us have gone through so much gaslighting, so much doubt, so much fear, and so much physical pain and suffering on top of that. So that validation and that encouragement is really, really meaningful, Dr. K. Thank you so much. So if anyone needs to have a chat, event, just reach out to me on my DMs. I know there are so many questions here. We weren't able to get to them, but I really appreciate everyone showing up, everyone interacting, everyone listening and coming along. Thank you so much. This will be available to listen to again if you want to go back through anything. But in the meantime, reach out to us if you need. Thank you. Thank you so much, Fernanda and Dr. K as well.
Thank you for
It's
having
really
us.
special that we can come together and do something like this. Yeah.
Thank you.
Awesome. Take care. Have a good night, everybody, and beautiful day for everyone on this side of the world.
Yeah,
Bye.
thank you.
See you.
Bye.
Bye-bye.